question from our Instagram follower. Dr. Maia, should I do a facelift and neck lift at the same time as the eyelid surgery? Or should I do my eyes first? What are the pros and cons of combining everything at once? So it is a very common question here in the office. So during the consultation, we'll discuss this more specifically. It is based on desire, what you want to change, if you're ready emotionally for that. So you can separate these procedures. If your main concern is the upper third of the face, we are looking more for brow descent, so brow lift, and eyelid surgery, upper and lower eyelid surgery. I usually do these procedures in combination. However, you can also break them down to smaller procedures. So eyelid surgery, upper eyelid, just access the skin in the area we can do here, awake under local anesthesia, takes 30 minutes. If you want to rejuvenate the whole area, we're looking at temple lift, upper blepharoplasty, lower blepharoplasty, and fat grafting to the cheeks and along the lower eyelid. These are amazing procedures. You can see beautiful results with just rejuvenating the upper third of the face. However, when you do them all together, eyelid surgery, facelift and neck lift, you only have one downtime. It's a little bit of a longer downtime, between 2 and 3 weeks. And you're ready for major events at 6 weeks. Although most patients like to do everything at once, just one downtime and everything looks more natural, more balanced, it is an option for patients to start with baby steps and do smaller procedures like fat grafting alone or eyelid surgery alone. However, when you consider doing the face and neck, usually they're doing in combination. One of the common questions in the office is, can I just do neck lift alone or face lift alone or brow lift alone? One of the important concepts to understand is that all this area here is connected. So you want to match the results of a brow lift, face lift, or neck lift. When you lift the face, you can see that lifting the face alone, the neck gets better. So if you do the neck lift, you're losing that powerful lift that comes from the face. You're limiting that extra pull that you get from the top. There's a muscle here that goes from the collarbone all the way up, that when you advance this muscle and tighten it up this way, you can get that nice contour. So we don't want to lose that pull that comes from the face. And the other thing is, when it comes to brow lift, a lot of patients do have brow descent that comes over time with aging. And if you do facelift alone, there's this bunching of skin that comes from the top. When you do a brow lift, then you're addressing this area. You get that refresh and youthful look. If you have any questions, want to learn more about these procedures, call us. We are happy to help you. We offer virtual and in-office consultations with me and my coordinators.